mute button, and there's any noise, background noise, or if you're typing or anything like that, put on the mute and then just take it off if you have something to say. In that way, it'll make the call much better for people to be able to hear what people are saying. So what were you saying, George? You have a press conference.
Yeah, in about 25 minutes, I have to leave. And
Okay.
if there's anything you want me to add at that press conference, let me know.
If I can interject, yes, I would like you to put out there that there will be a visual at the state capitol on Monday the 14th. As a matter of fact, at 12 o'clock is supposed to be a human caravan pulling up, and they will stay there till the evening, and at 6 o'clock, others will be joining us for a candlelight visual with crosses in front of the state capitol.
Okay. Is there any chance you can email me that now as we speak?
Yeah, I sure can. So if you want to give me your email?
G as in George, Marcello, Marcello, at Rogers, with an S.com.
Hello. Okay, so let me just repeat this. G Marcello at Rogers, ROGERS.com?
That's correct.
Okay, I'll send that out to you this morning.
Perfect.
Hello.
Hello, is that Julie?
Hi, George.
Hi, Julie.
And Bill. And whoever may else be on the phone.
Yeah, there's a few early birds, which is good.
Yeah, that would be good. I'm not one of those right now.
Julie, if you need to use the mute button on your phone, do that. I just explained that to the other folks as well, and it helps be able to clearly hear what people are saying, and then just unmute it when you have something to say.
Oh, okay, it's pretty quiet here. So.
Okay.
Who do we have on the phone?
Well, we have Robert Coates, Tim
Hi,
Vega,
Robert.
George Marcello,
Hi, Julie.
and yourself, and me.
Oh. Okay. Who was the gal that was just on the phone?
Kim?
Oh, Kim. Oh. Okay. How are we all this morning?
Okay, Julie, this is Robert. How you doing?
I'm okay. My cat's missing again this morning. So I've been out looking for the cat. How are you?
Okay.
Good. How many people are we expecting on the phone?
Well, we're expecting some folks from around the country, but the important thing is we may get some very good new partners, both within Arizona, and right now what we need is as many organizations and folks stepping up to the plate to create the kind of leverage that will turn this thing around.
Sounds good. I'm going to be checking around with some of the local agencies like Child Advocacy Center and some of the others. Magellan, I've spoken to Mary Robeson, who's the assessment from Magellan, and they possibly may, be interested in some of this because ultimately it's going to affect the mental health workers as well with this cut.
Julie?
So, pardon me?
Julie, your audio seems to fade in and out. You may want to have your other phone handy.
This is the only phone that I have. The other phone is not charged.
Oh, okay. All right.
How bad is it? I'm moving around. That's the problem. I'll stay stationary and that.
Oh, okay. That might help. Okay.
Take care of the issue.
All right.
Is that better?
Because the call will be today. Going to try to keep it to about an hour because we're all pretty busy. However, if it really gets going and we're really onto something and have to run over, then I'm certainly flexible in that regard.
Hi, this is Liz, Rachel, and Christine from Families USA.
Okay, Liz.
Hi. How are you guys? It's early for you.
Yes, it's 7:30.
I'm in Arizona, Liz, and it's early.
What's that?
I'm in Arizona. It's very early.
Yes, I know.
Where
So
are
it's
you
Liz, Rachel, and who else?
Christine, they're both on our Medicaid team. Someone's going to be joining for communications, but they're not in here yet.
Okay, is that Dave or Bob?
I'm not sure. We have a number of people on our team. I think it might be Dave.
Okay.
He said he was going to come, but he also might send someone else. We have a meeting at 11, so I'm not quite sure if he's preparing for that or what. But we're happy to participate. And Rachel and Christine are both savvy on Medicaid, so.
Okay.
So this is Families USA,
Yep.
and where are you folks out of?
So we're out of D.C. We are a consumer health advocacy nonprofit, and at least for us, we do spend a lot of time working with state advocates. So there are a number of people that we work with there in Arizona, and we're happy to make new connections with you all too.
Thank you. We're really thankful that you came today.
Well, good.
And my name is Ms. Ackley, and I'm the director of the National Association of HCG Task Force and co-founder of the Dream of Life Coalition here in Arizona.
Well, great.
We'd really love to partner together with as many organizations as we possibly can.
So we'll give everyone another minute or two to sign in, and then we'll get started.
Hey, this is Ken Jacobson.
Ken, very good. Glad you're there.
Sorry?
Hi, this is George Pauk.
Robert Cohen.
Okay, that was George. Say again.
Oh, George Pauk, P-A-U-K.
Dr. Powell. Okay. Good.
This is Ken Jacobson again. I have to tell you, I'm actually at the DES office waiting in line to be interviewed for access.
Okay.
So I may have to bail at any moment. And I hope it's not too noisy.
Hi,
No,
Liz.
if you want, Ken, if you want, you can put on your mute and then just unmute it when you have something to say, and that might be easier.
Okay, yeah, okay.
Okay, well,
Bill, it's Liz.
okay, good. Liz, you want to introduce? Hello? Hello? Who's calling in?
Bruce Madison in Denver.
Very good, Dr. Madison. Glad you're on board. We're going to get started in about 1 minute.
Okay.
Okay. Just waiting 1 minute for Liz Perry. Do you think it'll be very short that either Dave or Bob will be on?
Christina's gonna go check on Dave, but you should just get the call going. I think that's fine.
That's good. All right, thank you. Okay, everybody, I'm Bill Remack, and just going to moderate this call so that it goes smoothly and we can get to the issues. We'll do a brief roll call here, and I'd just like somebody to start, and we'll go down. Just state who you are and where you are and what you do and what your involvement is. So why don't we start with Pastor Code? You want to go ahead?
Robert Code?
Okay. My name is Robert Code, and I'm a retired United Church of Christ minister. And my interest is to invite the church community, church and synagogue communities to participate.
I'll go next. I'm Dr. Bruce Madison. I live in Denver. I received a heart transplant in end of 2004, and I'm here to see that these patients that were promised this life-saving procedure get the promise that the state made them.
Thank you.
I'll go next. My name is Kim Vega. My brother has been affected by the cuts here in Arizona. I'm an advocate for 98.com, and I am here today to ensure that funding does get restored for the 96 remaining in Arizona.
I'll go ahead and go next. My name is Ms. Alklin. I'm the director of the National Association of HCP Task Force representing Arizona. I'm also the co-founder of the Dream of Life organization, and also the inspiration and coordinator for the Dream of Life March, and this march to the Capitol is incredible. And also I'm helping to aid in getting the transplantation that they need here in Arizona.
Okay. Next.
This is Liz Perry and Rachel Klein from Families USA. We're a healthcare advocacy group based out of D.C. And Bill asked us to join to help you guys strategize ways to fight these cuts.
Thank you.
And this is Liz Helms from Sacramento, California. I'm the chair of the California Chronic Care Coalition.
Okay, thank you. George?
I'm George Pauk. I'm a retired physician. Diabetes was my main field, and hypertension. And I am mostly interested in a national health plan. I'm an Arizona representative of Physicians for a National Health Program.
Very good group. Ben Jacobson, you still there?
Yeah.
Right.
Yeah. Hi, I'm Ken Jacobson. I'm actually an access patient. I'm in Arizona. I'm in Tempe, Arizona right now. I'm actually in the DES office waiting in line to be readmitted to access. We have to reapply every 6 months in this state. I met Bill last week at the march in Phoenix, and I'm an activist for healthcare.
Thank you. Christine, you want to say something? Is Christine on the line? All right. George?
I mean, with Christine with Families?
Oh, yeah.
Oh, yeah, she just got back in. Dave's in on a call right now, I think, and so I think after he's off, he'll join, but we should just start.
Okay, thank you.
I'm here, Bill. Sylvia.
Sylvia, oh, good.
Yes.
Introduce yourself.
You know, your Spanish connection.
Hello?
Hello, Sylvia?
Oh, hi.
Hi.
I couldn't hear you for a minute there.
Okay, could you repeat that? I think we lost you for a moment.
I'm Sylvia Hinojosa Price, and I'm a registered nurse in California, and a friend of Bill's. And I'm here because Bill asked for some help with maybe doing interviews in Spanish on the Spanish radio, television, something like that. So I'm here to help. Hi, Sylvia. It's Julie. Hi. Jacqueline. How are you, friend? Good, thank you.
Very good. George, Marcello?
Yeah, hi, it's George from Toronto, Canada. I'm the CEO of Step by Step. We've been conducting student torch relays around the world to promote organ and tissue donation, so anywhere I can help, I'm here.
George, I think we're losing you.
I'm George Marcello from Toronto, Canada. I'm the CEO of Step by Step. We've been conducting student torch relays around the world to promote organ and tissue donation, so I'm here to help.
George, something's wrong with your audio.
Okay. Let me just fill in for George. He's a advocate, global advocate for organ transplantation, and he started a torch relay which has gone across the world, and he brought it to Arizona last week for the first time. And this is an object that has been blessed by the Pope to signify and encourage people to donate organs. And he is has run several times across from one side of Canada to the other a number of times. And
the fact that it's been blessed by the Pope is going to get to the Latino community, that they're all Catholic, almost.
Yes.
So that's very good. I'm glad you said that.
Okay. Was there anyone on the call I missed?
Yeah, Bill, this is Matt.
Okay. Matt, introduce yourself, please.
What's that?
Would you please introduce yourself?
This is Matt in Phoenix. I know Bill and Julie. I'm spokesman for Recall Jam Brewer.
Okay. Very good. All right. So I'd like actually Kim to give a little bit of an update on what the situation is, because there's several people on the call from outside of Arizona that aren't intimately impacted by it, and so perhaps Kim, if you kind of give an update on some of the situation as it developed, and what actions have been done over these last few months.
Well, initially, if you all don't, haven't heard or read the paper or viewed the media, on October 1 of 2010, Jam Brewer implemented HB 2010, which made cuts to organ transplants. I mean, made other cuts on access, but the one that's in the forefront is she made cuts to organ transplants. And as a result of it, we initially had 98 people that were on the list for transplant here in Arizona. We have lost 2 lives, and we stand with 96 remaining. We have made great research and had a gentleman out of Chicago, who was a law student, researched the fiscal year 2011 budget and came up with 26 ways that the state could, restore funding. That, in adjacent to submitting current data that shows and came up with 26 ways that the state could, restore funding. That, in adjacent to submitting current data that shows that transplants are successful, were submitted to the governor and her administration, and her position continues to be that the state does not have the funds to restore funding. And in addition, she was just notified by Secretary Sabellis that a waiver isn't needed to make further cuts to Medicaid, and just signed a bill that will go into play on October 1 of 2011, cutting an additional 250,000 people from access. Since then, we have been advocating. The voice of these 98 are on Arizona98.com, and we have been holding vigils, marches. We work together with the New Life Society, which are individuals post-transplant, to demonstrate to the state that, transplants are very much successful. And here we have living proof, including one of our own, which is Representative Anna Tovar. She is a two-time recipient she's had stem cell and bone marrow.
Very good. Thank you. Thank you. One of the reasons that I asked everyone to be on this call was that it became apparent that even though activities were going on in Arizona, we've had some national exposure, but we really need to bring this issue into the forefront. This is much, much bigger than in terms of lives and impact, both in Arizona and on the nation, than what is going on in Wisconsin and other things are right now in the news. Simply taking 300,000 people off the rolls to have access to care and not provide any alternative as a substitute is unconscionable, and we need to see that this is an effort to derail health reform by cutting or eliminating Medicaid, but also that this might spark other states from going to these lengths as well, and this is revolutionary in terms of creating a very divisive situation in our country and derailing health reform, which we've worked so hard for, simply just to get to the point where we are now, and we still have a long way to go. And to have Medicaid end up becoming dismantled could be catastrophic. We don't want to see people dying in the streets. We don't want to see people leaving our country or our states and trying to find alternatives when our government and our partnerships and what have you should be taking care of our citizens. So we need to discuss now ways we can bring this out and get national exposure. So just anyone pipe up, say, any ideas you have, just let's speak freely and see if we can come up with a semblance of a plan, because even though we are making efforts, we need to involve a lot more people, a lot more organizations, both within Arizona and outside, create some real solidarity and devise something that will make a divisive and quick impact to reverse this situation before anyone else dies.
Well, this is Robert Coach, and my interest, like I said before, is to appeal to the churches and synagogues. And the reason for this is, as we learned from the Civil Rights Movement in the 60s and 70s, the churches, synagogues represent the point of view of people with moral authority, and the morality of this movement is clear, but I think it hasn't been communicated adequately to the churches and synagogues.
So, what would be what would be the strategy to proceed in that direction?
Well, I've already taken steps with my own local congregation, which is an active congregation, the First Congregation United Church of Christ, and we have a assistant minister assigned to this coalition, and I'm a retired United Church of Christ minister, but also work as a professional community organizer and union organizer. So I know a little bit about how to reach organizations, and it needs to be multiple. I'm glad to see someone from Washington, D.C., because we have our denomination has a very active office in Washington, D.C., but and so do other denominations. So you appeal on to church synagogues on a national level, international level, work through the World Council of Churches, national level to the National Council of Churches, and synagogues, and there's a national Jewish organization. So, and then you work on reaching churches and synagogues on a local level. So you have a two-pronged strategy: national, including international, and local.
Okay. So that's purely as a human rights issue, and with the local issue, do you create a front on the local level and then express to your global counterparts there is a situation and they come on board? Is that how it normally goes?
Yes, the goal is to recruit activists. In our denomination, we have a very strong Justice Department on a national level. So the goal would be to recruit activists, which I did as a follow-up to Saturday's Dream of Life walk. I sat down with our assistant minister and got him interested in what we're doing. So you have to focus on church, synagogue activists and leaders who have a self-interest to see that their denominations are active on social justice issues.
All right. That sounds good. Let's see, Liz, Terry, could you talk a little bit about what families can do to mobilize several organizations in Arizona as well as those across the country in terms of getting perhaps some media exposure on this issue, and also make this issue not just a human rights issue, but an issue in the forefront of also as an impediment to health reform.
So this is Rachel, Families USA. I wanted to just ask a couple of questions and even make an observation. It seems like the goal for the activity here is to try to get Governor Brewer to consider the request to put this coverage back, right? That's the main goal, is to try to get her to change her mind.
That's correct.
And And so I guess the question I have is whether national media is the way to do that, or if this is better to have an in-state strategy to try to change public opinion within the state to put pressure on her from her constituents. And then one of the observation I guess I wanted to just make is this story has gotten someplace nationally, and we've been following this. I think the problem that we're going to have in terms of national media is that we have some federal fights that are going on right now about the future of the Medicaid program. And the big thing that we're hearing from governors and from members of Congress is that Medicaid is just too expensive and we don't have the money for it. And in some ways, when people raise the issue about the Arizona cuts, it's used as evidence that things are so bad that Arizona can't even afford to provide this coverage. And isn't it sad that Governor Brewer had to make this tough decision?
Well, let me just interject there, okay? The fact remains that the state of Arizona does have the money to reinstate funding. She's just taking the position that she'd rather allocate those funds to entice corporate America to come into the valley to stimulate the economy versus them reinstating lives.
No, I hear you, and I understand. I guess I'm just saying that we have to be cautious as we proceed with national media, how it's framed and how it fits into this larger picture about what happens to the Medicaid program nationally. Because we're facing a fight that's coming up about whether or not to block grant the Medicaid program. And that would give every state the ability to do the kinds of cuts that Governor Brewer is talking about and then some. And we're really gearing up to fight that. I think that it's helpful on that front to hear all of these stories about what is happening to people because they've lost this benefit. I just think we need to both figure out how we can try to frame this in the national media so that it's helpful for you and helpful for the federal fight that's happening.
Well, enlighten me if you will, okay? And if I may say, educate me, please, okay? Obamacare is supposed to go into effect in 2014. Is that correct?
Yep.
Okay. And when Obamacare goes into effect, what happens to the people that fall, below the poverty level? I mean, everyone should have health insurance of some sort. I mean, am I wrong in that statement?
No, that's the idea. Below 133% of poverty should be in Medicaid, and up to 400% get subsidies for private coverage.
Okay, so if that goes into effect in 14, all right, then states will be forced to take care of those under the poverty level. Is that correct?
Yes.
All right. So I guess I'm having a hard time understanding why the position that they're taking at this point in time, and only in 2 years' time, they're going to have to go back to where they started from to begin with.
Yeah, I agree with that statement. This is a Tricia loophole. I think that we've got another agenda going on undermining us in the attempts to reinstate Medicaid. I think the agenda of Governor Brewer is to undermine Obama's health care plan. And if that is the case, then that's what we've got to counteract.
And I agree with you. I think, well, I think not only that, I think that, she's taken the position to reduce federalism, period. Okay, she doesn't want to be told how to allocate her funds. All right, and second of all, she blatantly made a statement, all right, on the news stating that there are too many ties associated with federal funds. Well,
Hi, this is Bruce
reality. This is the reality of life. In anything that you do, there's always a tie of some sort. Nobody does anything in this world, for the mere fact of just doing.
Bruce, Brian. Yeah, I would just like to make a comment because I think that the framing of the issue is important, as the lady from Families USA said. And the framing has been done is that the states simply don't have the money to to cover these benefits anymore. That's what I've heard from medical people in Arizona, is that it was a tough decision, but it had to be made. I think I would counter that by saying, yes, there is enough money. It's just improperly allocated and concentrated.
And that's right.
And making the argument, I have no doubt that there's enough money to keep these people on Medicaid and keep this transplant funding going. But it's so concentrated in a very small portion of the population that they make the argument that there is no money, but it's there. It's just incorrectly allocated and incorrectly concentrated. And I think that may be one way to frame a response to those that say that this was just a tough choice.
I think that's right. It's a question of priorities, right? And we're asserting that her priorities are not in order.
Exactly.
Right.
We have, Ms. Acklin, we have a orangutan who's getting a new habitat, okay? And we all know that that's quite expensive for, to build a new habitat. Now, I just find this very, very appalling that, we can get have a habitat for an orangutan, but when it comes to human life here in Arizona, they're disregarded.
Well, the fact that a bridge was incorporated to preserve, squirrels, okay,
yes,
which was over $2 million. I mean, please,
right.
you want us to sit here and digest this and say that we definitely understand when, you're putting human life on the back burner?
I had someone present that argument to me and address Governor Brewer as doing right. Their statement was that this money allocated for the Squirrel Bridge was applied for under a federal grant that had absolutely nothing to do with the Medicaid issue. And that's how they defend these actions, that this money is separate from any of those funds. I agree with you 100%, but this is the reality of it and how we justify it.
Well, what the doctor said was totally correct. It's about where this money is being allocated. Representative Tovar said there's $1.so many that is available, and no one's doing anything about any of this. So what we're doing is we're continuing our efforts in the community to have walks and marches and to show up at the Capitol. They've even removed the stone benches from the
Capitol. So that people cannot sit down anymore.
So they cannot sit down anymore. The sick and the suffering who collect at the Capitol can no longer sit down. This is a pure reflection of what I call, and the people of Arizona, retaliatory measures against our First Amendment right to gather at the Capitol. There has been folks that have called down there to ask them. They don't have any answers of where these benches have disappeared to. And there are folks that want to file police reports stating, okay, well, if you don't know where these benches are, then maybe someone's stolen them. We need to file a police report because the taxpayers paid for these benches. It's a whole lot of different issues that are, and then not to mention Governor Brewer going to vacation in Alaska while people here are dying. And we're not going to stand for it here. How much is this costing? Is this the lobbyist money? Where is the money coming from to take a long vacation in Alaska?
Well, people are dying on their doorstep. I don't know how she can do it personally.
Absolutely.
This is Liz from California. Where is the legislature in all of this?
The legislature's position is every time Representative Tovar looks to put something on the floor, they don't have time for her.
Roadblocks. Many roadblocks.
When we first started this effort, there was a consensus that if we could come together and persuade Brewer to change his policy, accept that Medicaid funding that she would be reimbursed for, there was only like $1.4 million that needed to be raised to put all 96 patients back on the list.
Yes.
And we thought that if we worked with her on an equal level there, if you do this, then we'll raise that other money. It won't cost Arizona nothing. It'll be raised through private there, if you do this, then we'll raise that other money. It won't cost Arizona nothing. It'll be raised through private, organized fundraisings and things like this to compensate for and I think that's the only way we can even get her to the table to talk to us.
Matt, could you give a kind of a snapshot of the legislative, how right now it's composed in terms of its leaning and the politics in terms of the position there, collectively, and the majority situation and so forth. Could you do that?
Yes.
Matt?
One of the representatives, two of them were supposedly, and I think somebody else needs to speak up on this because I haven't had an update on it in a couple of weeks. There was supposed to be legislation.
Yeah, Matt Jett is on the line. Matt, you on there? Oh, maybe he's not. Okay.
And I don't know where it's at now, where it stands. But I think that if we're going to help these people, attacking her or her policies is not the way to go. We're only going to alienate her. We've got to find a way of getting her back to the table and accepting this Medicaid.
Exactly. The political solution.
My God, she's got the power to pardon in this state, and yet she's handing out executions left and right.
It's awful. The stories I've heard just send you to bed in tears.
And I don't know how else to approach her. I mean, I agree with you, all right? Being derogatory, name-calling, accusations, so on and so forth, okay, is not the answer to this solution.
Right.
However, I have requested an audience with her, and naturally I don't get any response. I mean, you do know that's a given, all right? But, I mean, I would just like to talk to her as a human being. I mean, I would like to just ask her, all right, how she wants to, see her legacy as a governor unfold. You've made the history books, lady.
Exactly.
You want to be associated with the title of Grim Reaper and Death Panel?
Oh, my.
You should be the welfare of your citizens in this state, okay, should be your utmost concern. And quite frankly, not on my watch would I ever compromise a life to allocate funds in another area.
Yeah, exactly.
Well, if there is another agenda going on here, which I seem to think is the case, to, like I said earlier, undermine Obamacare, it would explain to me why we're having such a difficult time getting her to compromise on this with us. And, $1.4 million, with the right organizations involved, we could raise that overnight. So what is the problem that she won't even sit down and negotiate this with us?
This brings us to the question of, at this point, if we're going to utilize getting exposure while also building a consensus within Arizona, the biggest thing we can do in terms of creating an offense that will cause her to back down simply because of the political will is there because of public opinion, brings us to, well, how do we establish a uniformly very, very popular consensus in Arizona that has enough clout to push her back on the side of doing the right thing.
The people have enough clout, and that's why we need to keep this dream of life walk alive. We need to march to that Capitol every single day. We need to congregate, and we need to make our voices known. We are the people of Arizona.
I agree, but now
Hey guys, this is Liz with Families. I hate to interrupt, but Rachel and I need to head into another meeting, but we want to be helpful. So Bill, I don't know if it makes sense for you to just shoot me an email later,
certainly will.
and let me know if there's a way that we can be helpful, but we have to hop off. But it was good talking with all of you.
One thing before you go, Liz, and that is the point I was just coming to, which was building more capacity to advocate. Any partners you have in Arizona, if you'll send them our way.
I shot you an email last night with Matt's information, and I copied him on it.
Right.
And then I reached out to the Arizona Center for Disability Law. I haven't heard back from them, but I can, as soon as I do, I can shoot you an email with their contact information as well.
Okay. Any other disease advocates or health advocates that you're aware of, even though you may not be working directly with them?
Matt, honestly, those are the two groups that we work with in Arizona. I mean, I think if you reach out with Matt, he'll be able to tell you other folks that he works with, and maybe you guys can sort of fold into the stuff that they're doing.
Okay, excellent.
And vice versa.
Okay, I'll shoot you an email.
All right,
That'd be great.
Bye.
And I'll send your information to the other folks on the call here, so if they have any questions, they can also communicate directly with you.
So, Bill, this is Liz out in California. In working in you've got to put this together really strategically, but I like what Liz Perry just said about the Center for Disability Law. You've got to get attorneys involved that take this on as a legal, because if they're going to murder people, there's got to be something in the law that will not allow that to happen. And if it does, that they're held accountable for that. And it sounds like you already have had 2 deaths in Arizona, which is appalling. And you've got 96 people on this transplant list. I mean, their faces have got to be out there. But I agree, you have a tipping point here. And I don't know where Senator McCain is in all this, but you've got to start picking off legislators inside that can start working and building a consensus as you build this grassroots campaign to be effective. Because if you come out from the grass tops and hit the media without the solid grassroots at the ground, and it sounds like you guys are really starting to build on that, you don't want it to topple over because the foundation isn't there. You've got to have the foundation. And getting like we have Western Center for Law and Poverty here. I mean, they're involved in all these legal issues. And then employers need to be involved. This could happen to any one of their employees. It could happen to any person who's been a tax-paying, private, wonderful, working citizen who gets sick and all of a sudden finds themselves near homelessness or homeless and having to use the safety net. It can happen to anybody. And so the messaging is critical in how you start to build this campaign to be effective, because you guys have to win. You know, right. We're dealing with right now, they just passed, or they just recommended through our state legislature to give 7 office visits to people in the safety net a year, which means someone that's on the transplant list can see a doctor 7 times, and that's it. Or someone that's on dialysis can see a doctor 7 times. And they just, we really hit hard on that, and they changed it to a soft cap, which means the doctor just has to do a pre-authorization now. So we kind of won that issue without them losing the whole issue. The state needs money, and it just gives them more control of the cost. And so maybe, you know, it's just putting that strategy together that's really going to impact, you know, the ability for the state to do the work that it needs to do to protect the people who are most vulnerable.
But how do we do that when we've got lives that could very well die just tomorrow? Or 68, Tim's brother, he had 6% of his heart functioning. We don't have time to really strategize. We've got to do something now.
And not only that, I have also contacted, Senator Kyle and Senator McCain. And the response that I got was how unfortunate that this is unfolding in my life, and that they do wish me a positive outcome. However, this is a state issue, not a federal issue. And should I ever need them on the federal level, please feel free to call upon them, which is a blow-off.
That's a real blow-off, and they should be held accountable for that. They're representing the people of the state of Arizona.
Now, I'm telling you right now, within the next 2 months, I am planning a trip to Washington. All right? I am going to protest in Washington. I'm going to go to Sabelis' office. I'm going to hit Kyle's office and McCain's office in Washington. Maybe they'll hear me there.
Have you met, has Herb Schultz come to Arizona and talked to you guys about this?
Who?
Herb Schultz. He's the district director for U.S. Health and Human Services.
No.
Well, you need to get him there. I mean, you need to get him there, like, immediately and have a meeting with him. Just request a meeting. He's in San Francisco. Bill has his contact information. He needs to come to Arizona. That's one of his states. And he could probably do it very quickly. He's got the ears of Secretary Sebelius. He could be your biggest advocate.
We did a conference call with Health and Human Services not too long ago about this issue. They had a lot of good ideas to present to Brewer to compensate for the funding she feels Arizona doesn't have for these folks. That was right. Who was that, Bill? Who all were we talking to that day?
Those were that was Kirsten Sinema and David Shapira and
Senator Shapira.
And so forth. There were and Anna Tovar. These were in the state legislature, and I've talked to her. We right now need to build capacity, build and bring partners, the medical community, healthcare community, veterans, and so forth, and have them involved. Now, I'm sure Herb will be coming back within the near future to Phoenix or Tucson, and we might look at the possibility of trying to set up some way where we can have some dialogue, and preferably if we could have some dialogue with the opposition. So I mean, that would be, if we get them to the table, would be a huge step.
They were also looking on the legality of this move under federal law. Did we ever hear back anything on that?
I did. I sat down.
Well, there's been a lot of that put out there, like just traveling through the air, that there's, a violation of the 14th Amendment. Let's see on the constitutional end of it, that there's also been stated that this is under the criminal umbrella because it's criminal negligence.
Yes.
Whether these accusations or these statements, are truly valid, I am not an attorney, so I couldn't justify that. However, I will tell you that we are diligently trying to acquire attorneys, to take on this mission, to take on this fight, and that's what we're currently working on now.
So have you worked with the Center for Disability Law?
Yeah, we have. Let me give you an update on the legal part. I've had extensive consultation with Lynn Carmen, who is leading the Medicaid fight for the state of California, and he has informed us that he'd be very happy to have a coalition of organizations or consumer groups sign on to the Medicaid Defense Fund and sign on as friends of the court or an amicus brief on the issues of Medicaid cuts with California, and that could, other states as well could sign on to this suit, and it's scheduled for hearing in the U.S. Supreme Court. So, this is an enormous opportunity because we don't have to start from scratch. This has already been proceeding now for a couple of years, so we could just sign on to that.
Tim, does this fall under the Americans Disability Act Title
Yes,
III
yes, it does.
violation?
Yes, it does.
Because I think that everyone should start filing complaints with the American Disability Act Title II folks. All of the transplant recipients, families, should start filing those complaints.
That's a good idea.
Because I think
That's a real good idea.
A big message to the
Let
federal level.
me just remark a little bit on the legal issues. You're right. There are legislative issues, there are legal issues, and then there's public opinion, media, and so forth, and simply leveraging public pressure. But what we're talking about here is we are pressed for time, and certainly we need to have things going on all these fronts. And I like Kim's idea about going to D.C. and facing off with these folks.
But you
But I
have
got to tell you, we have to do something. We have to find a very, very effective strategy in the short term to save lives now. We have lives hanging in the balance.
There's no
I'm grateful.
It's a disturbing situation. Yeah.
Yeah, there's no time for negotiation anymore.
Right. I am grateful for all of you, your hard work and your efforts and your support, and I would never know how to perceive that to all of you. However, my brother is running out of time.
Right.
People are running out of time.
What about a documentary we could get aired? I mean, a heart-filling documentary. Do we have those resources?
Well, I have written to Michael Moore, who's notorious for documentaries.
Michael Moore, yes. We've been emailing.
Bill, you bring Michael Moore in, and you're going to get nowhere with a conservative governor. You know, I mean, he can pull the media in. You've got to get your legislature. You've got to look at the legal side of this. And if you've got in place in Arizona, and I'm on their website right now, a whole team of attorneys that are there to help you. And I don't know if you've been working with these guys or you haven't. But the Arizona Center for Disability Law advocates for the legal rights of persons with disabilities to be free from abuse, neglect, and discrimination. And that's what I'm just reading off of their website. I would get them involved immediately and see what they can do to block these things from taking place.
Maybe we should all gather down at the Disability Law Center.
Well, put a team together and request a meeting. They've got Randall Howe. I mean, you got to get these guys on board. I can't imagine that they wouldn't want to be on board. This is right up their alley.
What are you looking at right now?
I am looking at the Center for Disability Law, Arizona.
Okay.
It's www.acdl.com.
These are the guys Families USA works with.
Okay. You have a whole team of attorneys that specialize with people. I would get a team. I would get you guys together in a team and request a meeting with them immediately.
Are these free attorneys?
Probably. I mean, it's an association.
Well, because most of the families here have no money.
Yeah.
Right.
And having car washes and
people,
and whatever we can do.
It is so bad, Liz. These were people that were so-called living the dream life or what have you. They were working. They had nice homes. They've lost their homes. They've sold their furniture.
I hear you. Okay, so here's what is Arizona Center for Disability Law? The Arizona Center for Disability Law is a not-for-profit, public interest law firm dedicated to protecting the rights of individuals with a wide range of physical, mental, psychiatric, sensory, and cognitive disabilities.
So we contact them right away and see what requirements are, if we meet the requirements.
Their contact number, here's their phone number. They're on Washington Street in Phoenix, 5025 East Washington Street, Suite 202. Their phone number is 602-274-6287.
Okay.
And they have a toll-free number, too.
Can you repeat that number, please?
The 602-274-6287.
And what's the 1-800?
The 800 number is 927
Okay.
2260.
Okay.
And request an emergency meeting with them.
I'm going to post this on my Facebook page as well. And the Dream of Life, I think Bill can go ahead and maybe post that as well. And the people that are in the coalition can contact them. And if they get enough calls and if they get enough letters and faxes being sent into the Arizona Disability Law Department, maybe it will get some attention and they will come forward.
Well, you guys already look like you have a good, you know, you've got these 90, you know, on your website, all the pictures and the names of the people who are sitting on the transplant list. I'd put a packet together and I would get your key people there, people that are on this call right now, and request a meeting with them and sit down and get in there with them immediately.
There's a lot of people on that transplant list that haven't come forward because of HIPAA. They don't want, you know, their information disclosed.
They may not even know about it. You know, I think that's exactly what we need to do is get some attorneys on board. The disability lawyers are perfect for this.
Yeah, it sounds like these are your guys.
Yeah. So let me see who wants to. So who wants to volunteer to go to the Family Law Center, Disability Law Center?
Is there an address for that law center?
Yeah.
It's on
Washington Street in Phoenix.
What do you know exactly?
5025.
1025.
No, 5025.
Oh, 5025.
East Washington Street,
Washington.
Suite 202. And their zip code is 85034.
But I think that it shouldn't just be one volunteer. I think it should be a...
No, I'm asking. Brad, anyone just speak up if they want to assemble as a team and go over there. Julie, who else? Kim?
Especially the person who's talking, and I'm sorry, I need, is it Kim, whose brother is needing a transplant?
Kim Vega.
Yeah, Kim, I mean, I think you need to be at that meeting.
Hello, are you there? Is she there?
Yes.
I think she's... Hello, are you there? She can't hear us. Hello?
Is it on mute, Kim?
Yeah, she must be on mute.
Okay. Anyway.
You have her contact information in case she dropped off.
Bill does.
Yeah.
We'll have it.
She'll unmute.
Yeah, so she's come forward. I mean, you know, she's going to get in there and advocate for her brother. She's got the story.
So, Dr. Pau, are you still there?
Oh, yes.
Very good. Dr. Pau, is this something that you could go with Kim and Julie Acklin and perhaps Ken Jacobson over to the Law Center, as well as perhaps we could also get, let's see.
Hello, I dropped off. Are you there?
You're back.
Kim?
We can get Jonathan Weisbert as well. He's actually doing a press conference right now. But he was going to be on the call otherwise. And he's the former Maricopa County Health Officer, and he is very adamant about reversing this. So if we could assemble a team to go over there and have a meeting with these folks post haste.
Bill, Kim's back on the line, so we probably need to have her hear what she just missed.
What happened?
Go ahead.
So, Kim, what we're talking about is getting you together with a team from Arizona to go over to the Center for Disability Law and get the attorneys there helping you. They're a nonprofit organization.
Okay.
It sounds like they're, like we have Western Center for Law and Poverty and some other disability rights groups here in California. Sounds like they're very similar to that.
Okay.
And they're the ones that look like they might really be able to help you guys, pull something together fairly quickly. They should be all over this, maybe.
Do you have their address or contact information?
I'll send it to you. I'll send it to you right away.
Kim, I'm willing to go in the next few days whenever you're ready. And then there was another gentleman that Bill had asked if he would like to join with us.
Ken Jacobson, George Pau,
questions, if there are any that we have access to, would be a good one to have on board with that. And we need to document this. We need to just take a home video camera and start filming these efforts, to be later edited into whatever we can produce to get the public opinion in our ball court.
Well, yeah, then you can put it up on YouTube, and that'll probably start getting lots of hits.
Oh, exactly. That's what I'm thinking. Let's do some heart-stopping, true-to-life drama here of what we're going through.
Get together with these lawyers from the Center for Disability Law and get them on board so they can help guide you so what you're doing will be effective and really hit on your message. And that you've got some backup on the legal side so you're doing it right.
Kim, could you make a call and get an appointment, try to get an appointment within the next 48 hours or at latest maybe Monday morning?
Where, at the Center for Disability Law?
Yeah, sure.
Yes, absolutely.
Kim, you want to go Monday?
Get a time.
No, I can't go Monday. I'm sorry. I mean, I do have a full-time job.
No, Diane, whatever day that works. And then if the other folks that will go with her, will coordinate with Kim and Julie, just work your schedule around whatever you have to, and go with Kim, and if you can get any other folks as well. I think about 6 or 7 people would be about a max, because otherwise I think that would suffice, because chances are you will only be speaking with perhaps 1 or 2 of their attorneys, and they are they're either have a practice or they're doing an internship or whatever. But at least you'll open the door. And if you can get your meeting with the director of the center, that would even be optimum. And if I've understood correctly, Families USA, Liz and Rachel have already contacted these folks to work with us.
Excellent.
Well, as far as a filmmaker and a documentary filmmaker, I have a personal friend. His name is Gracie Merrill. He does documentaries and he does filmmaking. He's out of Tucson. I kind of like to have somebody follow us in our so that we're transparent, so that they can see how desperate we are becoming, and that this will tell everybody that we're not giving up. Now we're heading towards the legal aspects of this.
Yes,
situation.
good idea.
Yes,
I think that's what's going to win it over eventually, is get the public opinion on board.
Yeah, absolutely.
There's one other question I have, and that is, we do have somebody on the other side of the aisle, Senator Ash, who's very sympathetic, and this to work, it has to be a nonpartisan issue and simply humanitarian as well as legal and otherwise. But is there some way, Julie, that Representative or Senator Ash can be engaged in this? Because the only way we can move this also in that arena is to engage, have somebody start engaging their colleagues.
Yes, Representative Ash is a personal friend of mine, and we've built quite a relationship in the bipartisan roles in the justice, and now him being the health chair. So what I would like to do is I'll set up a meeting next week with Representative Ash to speak to him personally, and then if Tim would like to come along, if he has a schedule that will reflect, being able to come along, I had an opportunity at the rally where we were at the Capitol to speak to Representative Ash briefly, and he's quite concerned. But he's got roadblocks by Pierce. Okay, everything that Representative Ash tries to accomplish in being bipartisan and to not be a Democratic or a Republican opinion Pierce has something to put in the way. Now, we just found out that Pierce has now is saying that the media will no longer be
allowed to enter the Senate House.
Into the Senate at all. And the media is very upset about that, as well as a lot of the senators who feel that they're not afraid to speak to the media. So he's cut the media out of.
It's not only media, Julie, if I can interject. Anyone that comes in, if you are the media, you have to show a press pass, or if you have an appointment with a senator in the building, you must sign in and wait until you're escorted to where they are. But you know what? The Senate House is for the people. You should have the right. It belongs to us. It doesn't belong to them.
That's right. That's right.
It's your money, you paid for it. They don't have that right.
And when I heard this last night, it's got people infuriated, including the media. I mean, the media is even talking about it, how, they said, what are we supposed to do, wait out in the parking lot for them now?
Oh, my goodness.
The sad part about it overall, as I'm sure in other places in the country, but Arizona sorely lacks true leadership.
Absolutely.
And that's what our disadvantage is here.
So
all
you
right?
guys need to give the guys
governor,
You
even
need to
though
give the
she
cover.
is the governor, the woman has no backbone, okay, to stand up for what she knows is morally sound and morally right.
You got it.
Oh, agree.
It's true. We're dealing with a heartless human. I hate to say this, but I can't. When she's speaking on these documentaries, she has a smile on her face when she's talking about these transplant cuts. I can't overlook that as a human being. I just can't.
She has not demonstrated since the onset of this opposition. She has at any given time any sympathy for these people, what they're incurring, what their families are incurring. Let me tell you something. I could stand up there and tell you that, you know what, my budget, I don't have any money. However, my heart is with you, and I will continue to fight till I find, the resources to help you, get back to where you need to be. Nothing. She's very, comments like, you know what, we don't have to offer Cadillac insurance.
Exactly.
Kim, I
That's
think
what the word
Dr.
is
Pauk.
for. Cadillac insurance.
Hello?
Yeah,
Dr. Pauk?
shows nothing.
Hello? Doctor? Go ahead.
Yeah, I guess it would be good to just say something. I certainly want to help where I can, but I'm very busy with the other issues of Medicaid cuts and long-term plans and so forth. I do think, though, that one of the big things that you are perhaps could put a little more attention on also, in addition to your urgent plans, is the ethics of the governor or the legislature making decisions such as we're talking about. Because I think that our tradition in healthcare is that it not be left to politicians to decide who gets a transplant or who gets health care in general.
Exactly.
And that the governor made these decisions improperly, and that she needs or the Arizona needs a kind of an ethics commission to go back and correct this decision and go on with deciding who gets this and who doesn't.
That's true. I agree with you. An ethics committee would be appropriate here.
Yes.
Don't they have an ethics committee already formed? Arizona?
No.
Not to my knowledge.
We're the ethics committee.
You might check into that.
Put that on your list of questions that you ask the Disability Rights Center.
What's that?
Right.
Put that on your list of questions to ask the Disability Rights Center.
Right, because I think some of those attorneys should be sitting on this ethics committee, and we need to go down to the Capitol and submit a bill.
We have in California a commission called the Little Hoover Commission, and it is very similar to a kind of a grand jury function, which examines issues, and if there's need to create some reform, it then makes recommendations. And
we don't have time for all that.
No,
That's the
there's
problem.
no time to form a committee. That's the problem. We are the ethics committee. The people of